Hey everyone. Betcha most of you listening have dealt with knee pain at some point.
It's super common.
Yeah, like a quarter of all adults.
Yeah,
And it can really mess with your workouts.
for sure.
The thing is, sometimes the exercises we're doing to make things better are actually what's making them worse.
It happens a lot.
And that's what we're diving into today. Common exercise mistakes that might be messing up your knees even more.
Yeah, exercise can be tricky like that. Good moves can help your knees, but bad ones,
Or even good ones done wrong.
exactly, can lead to more pain and problems down the road.
So where do we even start? I mean, there are tons of workout plans out there.
Right.
How do we know what's right?
The first step, and this is super important, get some personalized advice.
Okay.
Talk to a physical therapist or maybe a certified athletic trainer, someone who knows knees.
Makes sense.
They'll look at what you need, figure out what's causing your pain, how bad it is, if you have any other conditions, your fitness level, all that.
Kind of like getting a suit made just for you instead of trying to fit into something off the rack.
Exactly. And they can teach you about how your knee actually works, all the bones and muscles and ligaments and tendons, and how different exercises affect them.
So we can make smart choices about our workouts.
Exactly. Not just following some random YouTube video.
Got to understand why we're doing what we're doing.
Exactly. And that goes for the equipment you use, too.
Okay, let's talk gear. What should we be using to help our knees during workouts?
Good shoes are so important. You want good cushioning, to absorb the impact. And arch support.
Right.
That helps keep your foot aligned, which affects your knees too. And a non-slip yoga mat's good for floor exercises, for stability. And maybe, depending on your situation, a physical therapist might suggest resistance bands to help strengthen the muscles around your knees, or even a lightweight knee brace for extra support.
Cool.
For certain exercises, of course.
So we got our personalized plan, our knee-friendly gear,
Ready to go.
ready to hit the gym. What's the most important thing to remember when we start working out?
Start slow. Gradual progression. That's where so many people go wrong. They try to do too much too soon, and their knees can't handle it.
Makes sense.
You got to give those muscles and joints time to adjust.
What's that saying? Rome wasn't built in a day.
Right. Exactly. Start slow. Maybe do some easier exercises for shorter amounts of time.
Right.
And as you get stronger and can do more, you can gradually make things harder, Increase the resistance, do harder exercises, or work out for longer.
Makes sense. And what about listening to our bodies? Like, when do we know we need to back off?
If you feel sharp pain during an exercise, stop immediately. But even if it's just some discomfort, like an ache that won't quit, don't ignore it. Maybe change the exercise a bit, make it a little easier, or take a break. It's better to be safe than sorry.
I like that. Better safe than sorry. Okay, so we're starting slow, listening to our bodies, and gradually challenging ourselves more. What about how we're actually doing the exercises? Does speed matter?
Big time. Slow and controlled. That's the key for exercises that are good for your knees.
Got it.
Think about it. If you rush through an exercise, your form gets all messed up, right? And that puts stress on your joints.
So it's not about how many reps we can crank out super fast, but more about making each movement really good.
Exactly. You want to feel the muscles working, keeping everything aligned, no jerky movements. You could even try counting the seconds during each part of the exercise, like 3 seconds to lower down in a squat and 2 to come back up.
Oh, that's a good tip.
It helps you stay focused on the movement.
I like that. Okay, let's talk about some specific exercises.
Okay.
Squats. They're in tons of workout routines, but I know they can be tough on the knees. What are some common mistakes people make?
The biggest one is letting their knees kind of cave inward as they go down.
Right, so it's like their knees are trying to touch.
Exactly. That puts strain on the ligaments in your knee, can lead to pain and instability. To avoid that, imagine a line going straight down from your kneecap to your second toe. Keep those knees in line with that the whole time.
So it's not just about getting low, it's about getting low the right way.
Exactly. Another mistake is letting those knees go too far forward past your toes. That puts a lot of pressure on the kneecap.
So how do we find that sweet spot for the knees?
Think about sitting back into a chair. Hinge at your hips, push your butt back as you go down, keep your chest up, core tight, and those knees lined up with your toes. Use a mirror to check your form.
Mirrors are our friends when it comes to squats.
For sure.
What about lunges? Another one that can be tough on the knees if we're not careful. What should we be watching out for there?
Make sure that front knee stays in line with your ankle. As you step forward, that front knee should be right over your ankle, not out in front of your toes. And that back knee, it should be pointing straight down,
Right.
not twisting in or out.
Got it. I bet putting too much weight on that front knee can be bad too.
Yeah, you want your weight balanced between both legs, almost like a 50-50 split.
Oh.
Front heel and back toes on the ground, you shouldn't feel like you're going to tip over.
Balance is key, even when we're lunging. Okay, before we move on, let's talk about that leg press machine. See people using it all the time. What are your thoughts on that?
The leg press is good, especially for those leg muscles, but there's one mistake a lot of people make that's really bad for the knees.
Oh, tell me.
Locking out the knees at the top of the movement, you know when you straighten your legs all the way?
Yep.
You're basically shifting the force from your muscles to your ligaments, which are not meant to handle that.
Ouch.
To protect your knees, keep your knees slightly bent the whole time. That keeps the tension in the muscles where it belongs.
It's all about keeping those muscles working the whole time.
Exactly. And remember, it's always better to focus on good form than lifting super heavy weights, especially when you're trying to protect your knees.
Good advice. We'll be back soon with more tips on how to save your knees in part 2, so stick around.
Welcome back. We're talking about all those little things we do that can make knee pain worse. And I think it's time to talk about warming up.
Or not warming up. I've definitely skipped it sometimes, trying to save time.
Yeah, but when it comes to your knees, those few minutes can make a huge difference. It's not just about time, though. It's about getting your body ready to work.
Okay, I'm listening.
Think of your muscles like rubber bands.
Okay.
If you try to stretch a cold rubber band, what happens?
Snaps.
Exactly. But if you warm it up a little, it stretches. No problem.
So how does that work with our muscles and knees?
Warming up increases blood flow to your muscles, which brings oxygen and nutrients. That makes them more flexible, less likely to get hurt. It also helps your joints move easier.
So we're literally oiling up our knees with a good warm-up. What's a good knee-friendly warm-up look like?
Start with some light cardio,
Right.
maybe 5 to 10 minutes of brisk walking or cycling, gets your heart rate up.
Right.
Then do some dynamic stretches,
Okay.
movements that take your joints through their full range of motion, like leg swings, arm circles, torso twists, walking lunges.
I'm always confused about dynamic stretches. What's the difference between those and the stretches we do after a workout, like holding a hamstring stretch?
Good question. Those are static stretches, great for flexibility, but those are best after your workout, when your muscles are warm. Dynamic stretches are for before, to prep your body for moving. They wake up your muscles, increase your range of motion, and get you coordinated.
So it's like a wake-up call for our muscles.
Exactly. And if you have knee pain, you can focus those dynamic stretches on certain areas, your hamstrings, quads, hip flexors, calves. For example, do some high knee marches for your quads, heel to butt kicks for your hamstrings, side to side leg swings for your hips.
I'm totally adding those to my warm-up. So we're warming up properly, we're using good form, we're listening to our bodies. What other mistakes do we need to watch out for?
Overtraining. I know, we're always told to push harder, do more, never give up.
Right.
But for our knees, sometimes rest is best.
That's a tough one. We think of rest as being lazy. But you're saying it's actually important for our knees.
It is. Overtraining puts a lot of stress on your joints. Inflammation, tiny tears in your tendons and ligaments, even damage to the cartilage. It's like driving your car with the pedal to the metal all the time. Eventually, something's gonna break.
So how do we know if we're overtraining? What are the signs?
Pay attention to how you feel. If you're always sore, tired, having more aches and pains, or not seeing any improvement in your workouts, those are bad signs. You might even feel less motivated, have trouble sleeping, or your appetite might change.
So it's not just physical. It's about how we feel overall.
Exactly. Your body's smart. It'll tell you when it needs a break. Just listen.
What about pain during exercise? Is there a good kind of pain when we're pushing ourselves and a bad kind that means we're hurt?
That's a great question. It's normal to feel some discomfort, especially when you're really challenging yourself. But if you feel sharp pain, sudden swelling, or if you can't move as well as usual, those are all signs that something's wrong. Stop and see a doctor.
So it's not about ignoring all pain. It's about understanding what our bodies are telling us.
Exactly. And everyone feels pain differently. What's a mild ache for one person could be really bad for someone else, especially if they've had knee problems before. Trust your gut. If something feels off, don't ignore it.
Okay, so listen to our bodies, rest when we need to, don't push through pain. What else can we do to protect our knees when we exercise?
Think about the types of exercises you're doing. Some are harder on your knees than others.
Like what?
High impact stuff, like running on hard surfaces, jumping rope, those can put a lot of stress on your knees, especially if you're not used to them, or if your knees already hurt.
So what are some good alternatives?
Low impact exercises are your friends. Swimming, cycling, walking, or using an elliptical, those give you a good workout without pounding your joints.
And when we're doing strength training, are there certain exercises we should focus on to help our knees?
It's not just about avoiding certain exercises. It's about understanding how your knee works and choosing exercises that make the muscles around it stronger, especially your hips, glutes, and hamstrings.
So it's a whole body approach, not just focusing on the quads.
Exactly. When those muscles are strong, they help keep your knees stable, absorb impact, and take some of the stress off your ligaments and tendons.
So stronger hips and glutes equal happier knees. What about flexibility? I feel like stretching is often forgotten.
You're right. Flexibility and mobility are super important for healthy knees. Tight muscles can pull on your knee joint, messing with your range of motion and making you more likely to get hurt.
So which muscles should we be stretching for knee health?
The usual suspects are your hamstrings, quads, hip flexors, and calves. You can do static stretches after your workout or dynamic stretches during your warm-up.
What about foam rolling? Is that good for the knees?
Foam rolling is awesome for releasing tension in tight muscles and improving your overall mobility. It's like giving yourself a massage.
So we're warming up, resting when we need to, picking knee-friendly exercises, stretching, and foam rolling. Anything else?
Let's talk about how fast we do those exercises. Remember, slow and controlled is good for your knees.
Right. Rushing through those reps can mess up our form and stress our joints.
Exactly. And that goes for any exercise. Squats, lunges, even bicep curls and tricep extensions. Focus on making each movement really good.
Yeah.
Feel the muscles working and don't use momentum to swing those weights around.
It's about being mindful and paying attention to our bodies, not just going through the motions.
Exactly. And another mistake is jumping into advanced exercises or heavy weights before you're ready.
I'm so guilty of that. Always want to do the hard stuff.
It's tempting, but gotta remember, slow and steady wins the race. Gradual progression helps you avoid injury and build strength.
So how do we do that?
Start with the basics, get good at those, then gradually make things harder. Maybe start with just body weight before adding weights, reduce your range of motion until you build up strength, or even just slow down the speed. Listen to your body and find what works for you.
Be patient. Respect the process. Okay. What else for happy knees?
Balance. People forget about balance, but it's really important for knee stability and preventing injuries. When your balance is good, you control your movements better, so there's less stress on your joints. But if your balance is bad, you're more likely to fall or land weird, which can hurt your knees.
So how do we get better balance? What exercises help with that?
Try single leg stands. Stand on one leg for like 30 seconds to a minute. You can make it harder by closing your eyes or standing on something unstable, like a pillow.
What about those wobbly boards they have at the gym?
Those are great. They challenge your balance, your coordination, and activate those muscles around your ankles, knees, and hips.
I'm going to try those. Okay, so we've talked about warming up, resting, picking knee-friendly exercises, stretching, foam rolling, focusing on good form, progressing slowly, and working on our balance.
Anything else?
One last thing, individualization. We talked about getting personalized advice, but it's important to remember that everyone's different. What works for one person might not work for someone else.
So what's the bottom line?
If you have a specific knee problem like arthritis or an injury, see a physical therapist. They can create a workout plan just for you. They can see what's going on, figure out any limitations, and give you exercises that will strengthen your knees without making things worse.
Exactly. Work with your body, not against it.
I like that. Okay, we've covered a lot today. Ready to wrap things up? We've talked about a lot of those exercise mistakes that can make knee pain worse. From warming up to understanding how our bodies move, it seems like the more we know, the better we can protect our knees.
Knowledge is power.
Totally. But before we wrap up, I think it would help to hear some real-life examples of how these mistakes actually happen and what people can do about it.
Yeah, hearing real stories makes it all make more sense, right? It's one thing to talk about knee movement in general, but it's another to hear about someone like, say, Sarah. She's 35, works in an office, and she was having trouble with her knees collapsing when she did lunges.
Yeah, I remember Sarah's story. I felt for her. She thought she was doing everything right, but her knees kept caving in. What was the problem?
Turns out she had weak hip abductors. Those are the muscles on the outside of your hips that help stabilize your pelvis.
Right.
And they also control how your knees move inward. If those muscles are weak, it puts extra stress on the ligaments inside your knee.
Oh, so it wasn't just her knee. It was those muscles around it not doing their job.
Exactly.
What did she do to fix it?
She started doing exercises to strengthen those hip abductors, like clamshells and banded hip abductions. She also used a resistance band around her thighs when she did lunges to kind of help keep her knees in line.
Smart.
It worked. Her knee pain got better, and she could do lunges again without worrying. So sometimes fixing those weaker muscles can make a huge difference.
It can. Now, I remember John. He was a runner, training for a 5K,
Mm.
started getting sharp pain in his knee, but he just kept running, figured it was part of training.
I hear that a lot, unfortunately, that no pain, no gain thing. It can be really bad for you, especially when it comes to your knees. Pain is your body telling you something's wrong. If you ignore it, it can get worse.
Yeah. For John, it turned out to be patellar tendonitis,
Right.
which is when the tendon that connects your kneecap to your shin bone gets inflamed.
Often from repetitive stress on the knee. Things like running and jumping, especially if you do too much too soon.
There's that gradual progression again. So how did John recover?
He finally took a break from running, started cross-training with low-impact stuff like swimming and cycling to stay in shape without hurting his knee, and he worked with a physical therapist to strengthen his quads and get more flexible.
Ah, makes sense.
That helped take the strain off his tendon.
And he was able to go back to running eventually.
Yep, but this time he was a lot more careful and paid more attention to his body. Okay, one more story. Amanda. She loved working out, worked out every single day, dedicated, motivated.
Sounds like me.
But it started backfiring on her. She had chronic knee soreness, was always tired, even having trouble sleeping.
I bet she was overtraining.
Sounds like it. Remember how important rest is?
Yeah.
Well, Amanda was pushing herself way too hard, and her body couldn't handle it. Overtraining can really mess things up. Weakens your immune system, messes with your hormones, and you're more likely to get injured.
So how did Amanda get back on track?
She realized that rest was actually good for her. She started taking rest days and doing things like yoga, stretching, and foam rolling on those days. That's active recovery.
Good. How'd that go?
Her knee pain got better, her energy came back, and she actually felt stronger and healthier overall. Sometimes less is more.
It's hard to remember that sometimes. Well, I think these stories really show how important it is to listen to our bodies, know our limits, and get professional help when we need it. Anything else you want to add?
Just remember, exercise should make you feel good, not bad. If your knees are hurting, don't ignore it. Figure out why and do something about it. With a little know-how and some effort, you can keep your knees healthy and keep moving for a long time.
I like that. Thanks for joining us for this deep dive into exercise mistakes that could make knee pain worse. Hope you learned some good stuff to keep your knees healthy and your workouts pain-free. Until next time, stay curious, stay informed, and stay active.